Welcome back. We want to get back to our top story, which is, of course, the knee injury that had fans across the country collectively holding their breath. The Joker limping off the court last night with just 6 seconds left in the first half. Not what anybody wanted to see.
No, and while we know it's not as serious as many feared, the team did confirm he suffered a hyperextension injury. So we don't know anything about this. Well, we know this much. That's why you brought an expert, Dr. Forrest Anderson, a sports medicine and orthopedic surgeon from HCA HealthOne. So thank you for joining us. First of all, this happened like in a freakish accident, and you treated the guy that stepped on his foot.
Well, first of all, thanks for having me.
Yeah, I mean, that's crazy. I was just learning this.
Yeah, no, I was just saying, back in fellowship at Stanford, Spencer Jones is one of my athletes, and we took care of him on the basketball team, and he's a great guy. And honestly, the first thing I thought of when I heard this morning of the news that it was just a hyperextension injury was, thank God Spencer is not going to get blamed for anything that's really bad that happened to Nikola.
Yeah, because he's the guy known around the league, yeah.
I mean, he's probably the best player in the NBA.
So explain to us what a hyperextension is, and I'm curious. I guess your body weight is your body weight for your knee, so his body weight is his as someone else's someone's. But talk to us about what the hyperextension is, and because he's as big as he is, did that make it worse? Could it make it worse?
Yeah, I think the best way to think about it is we all know the direction a knee is supposed to bend, and we all know the direction a knee is not supposed to go, the backwards way, right? Like a flamingo. And it's sort of the kind of, Spencer was backpedaling, covering Jaime Jaquez, stomped on his shin, ankle region, and really pushed that knee backwards. Nikola was also stepping forward to help cover and for some help defense there. And that kind of puts the knee in a position it's not supposed to be in. The thing that we can sort of fall back on now is that nothing was torn, there was no structural damage, and all the structures that are supposed to protect your knee did what they were supposed to do. So those ligaments, those tendons, all took that force, absorbed it, and protected the rest of his knee from anything serious.
We have watched him play with blood on his face and his arms. I mean, he is a tough guy. He rarely gets hurt. But when you see him like that had to hurt like crazy. And he had to know something else was wrong.
Yeah, exactly. You get to know your athletes, and as fans watching him all the time, we get to see him. He's not the kind of guy to show that emotion unless something really bad happens. So everyone, I was watching the game, and you just swallow your heart when you see that kind of thing happen. But, luckily, it's not the sort of traditional injury mechanism that we see for something like an ACL tear, which is more of a non-contact planting injury. But also, these guys are big. There's a lot of energy getting thrown around. Like you said, he's a big guy with a big knee. And when, two of them collide, it's almost like a mini car crash. And you can see that, particularly in football, when you see a helmet hit a knee, anything can happen to that knee.
How dangerous is this kind of injury in tearing ligaments, or can a hyperextension lead to an ACL tear or meniscus tear or something?
Yeah, it kind of all depends on how far it goes, really. And anything's kind of out the window once the knee starts going in a direction that it doesn't belong in, right? So if you think about people here about the MCL and the LCL on the outside of the knee, those keep the knee from going one side or the other. So if you start to get a little bit of, instead of straight backwards motion to the left or to the right, you can injure one of those. The ACL and PCL are in the middle of the knee. They sort of form an X, preventing some rotation, but also going back and forth. So if you think about a hyperextension, that's kind of pushing the tibia backwards and really putting things at risk there for sure.
So what happens now? We say 4 weeks. What happens? How do you treat something like this?
Yeah, so luckily it's not a surgical thing. I
Okay.
think everyone understands that at this point, right? It's not a surgical thing. It's not something that needs a cast. Probably isn't even something that really needs a brace. It's more of something that needs some rest for the knee to calm down. And these guys are pro athletes, so he's going to be in with the trainers, in with the staff immediately working on getting things back. As opposed to, if this happened to you and me, it might be more of the kind of thing where we really take it easy and stay out of sports for as long as we can. For them, they're already working on getting him back out there with all these STEM modalities, working on things like that.
Would he be, like, when we see him back, will he be wearing a brace, do you think, or anything like that?
He might be. It depends kind of on how he's feeling, really. It's also a part of the season where they can really take 4 weeks off as opposed to the playoffs or even a run up to the playoffs where they can take time and really make sure that that knee's back to 100%. We all think back to some horror stories, when Kevin Durant in the playoffs came back pretty quickly from
Yeah.
a calf injury and then tears his Achilles, right? So you don't want to rush anything with this, but sometimes, unfortunately, in the playoffs with pro athletes, timetables are accelerated, but right now, if we had to choose a time and an injury for him to get,
Right.
not a bad.
Sort of a best case scenario when you're dealing with these kind of things.
Exactly.
No one wants to get
when
injured.
you see that happen
Yeah.
to him, this is, manna from heaven, right?
Yeah. And it comes from the doctor.
Absolutely.
That's what we need to hear. Dr. Forrest Anderson, thanks for joining us. Thank you so much.
Thanks for having me.